So we have another question. Which country would you say has the best policies in place to enable the future of work?
I'll hand over to you, Vincent, for that one.
Yeah, I think that there are a few countries that have put things in place in terms of the future of work. I mean, the UN just released something. It's not really a country, but it will definitely inform policies. I know France was very ahead in some aspect of it. I know New Zealand, Australia were doing some work there. I mean, in New Zealand, we had the Business Advisory Council that the Prime Minister Jacinda Ardern had put together to really a task force specifically focusing on the future of work. So McKinsey did a study there and really get some numbers around jobs displacement, skills that were needed. So 700,000 jobs gone, 900,000 jobs created in the next 5 to 10 years in aggregate. What are the skills that are needed? So a lot of focus has been put in there. I think it's still early days. And I think, like we said before, future of work was important, but never really urgent. And, you know, there's future in it. So people are, well, it's not today. I think what we're seeing is that it's today now, it's even yesterday. And so countries are starting to realize that they need to do something a bit broader in that area.
So there were two questions raised in the United Nations article, and I'd love to get your thoughts on them. The first question is, to what extent will the pandemic entrench rising inequality? That's a big question. And the second one is, how does mental health play into the remote work environment? Are there concerns that we should be having and dealing with?
So I might start with the mental health one, because I think it's something that I'm, personally very passionate about as a psychologist. And, we are seeing massive increases in burnout right now with employees, and organisations are very concerned. There was something I was reading, just even today around some research from Monash University that they just completed, saying that a third of workers are saying they're experiencing severe psychological stress during COVID, and that can be for a range of reasons, such as social isolation, which there's a reason why solitary confinement is used as a punishment, right? People are collaborative, right? They are social creatures, and being isolated from others is very stressful. But in addition, then you've got the financial stress, people losing their jobs or hours being reduced, or pay cuts. You've got job insecurity then for those who do have jobs, and so people now, as they've sort of started to adapt a little bit to this new normal, are also now concerned about returning to work, right? What happens if, as we return to the office, there is a spike? Right, there is an increase in in COVID cases again, and is my job still secure? So we've always had a very stressful, I think, working life, and now those stresses have increased, and so there are a lot of resources now that governments are actually releasing to help businesses identify psychological distress and actually intervene and provide strategies to actually support support individuals. And so as I said earlier, with burnout increasing because of juggling work and children at home, as you mentioned earlier, Vincent, and all of the other demands that go along with that as well. Some are saying that we are on the precipice of a major psychological crisis amongst population right now. So I'm personally really concerned about that from a health and wellbeing perspective, and I think that organisations absolutely will have to have a massive part to play. I think governments as well, in terms of healthcare facilities. Challenge is a lot of the burnout is from our frontline responders as well, but we will definitely need more resources to support people's psychological wellbeing, and I think part of that could be supported by greater flexibility. Right? If people are just not feeling like they can work that day, actually it's okay to take a mental health day, right? Just be and feeling psychologically safe to actually say to their manager, hey, you know what, I just need a day. And the manager saying, that's absolutely fine, you go for it, right?
Yeah.
And so I think that, you know, a greater compassion for each other, that human connection that we're all craving, we now need to show that empathy, you know, certainly to each other.
Yeah, I mean, I couldn't agree more. We've had a lot of you know, cases of people really being stressed working from home for multiple reasons, but you know, from family, you know, the setup, the technology, all the rest of it, but also the sense of not really being left out, maybe like am I not part of all conversations? Because in the office, I can see when there's a meeting and there is no meeting. So I know that I'm part of all the important conversation, but am I on the right Zoom? You know, I hear people that are 10 hours back to back on Zooms and I'm not. Am I missing out? Am I doing something wrong? Interesting thing though is today on the call with the few companies that we were on, they looked at the sick leave, and across you know, the month and a half that we were in isolation, the number dropped drastically, right? So they don't really fully know yet why, but sick leave historically has been, you know, at a certain level, and for a month and a half was almost at zero. And so what was it? Because people were staying home and therefore less exposed to you know, other things, probably less stressful for some or others. So that's the study that now companies are starting to do and say, well, look, if people are less sick, it's actually probably better to leave them you know, work wherever they want. And there is this movement starting to be created of like companies trying to move from agnostic location. And so the work should be done from anywhere. It doesn't mean that we remove an office. It just means that we allow people to work in different places. And that will change the way our offices are built. That will change what we need to build, and how we will, as a society, interact with each other. I think the major issue that I see though is our brains are not really designed for uncertainty and constant uncertainty, right? So in the military, we train a lot on this because, as you can imagine, I mean, we plan for a mission, but then when you're dropped somewhere, it's all different. No matter how much you plan, I mean, you still have to plan. But we train a lot for to try to be at our best when everyone is not. And that's quite that requires a lot of training, and you're also very stressed, but the human brain is not made to be consistently you know, worried. And that's why, you know, from early days of humanity, people gathered together, yes, because they can kill more things and eat more, but also because there is more certainty within the group. And you're like, well, if we, you know, can I sleep now and you protect me? Right, thanks, I can sleep. Otherwise, I don't stay alive a lot. Right?
Great. And there was a first part to that question.
Yes, it was about rising inequality and COVID-19. Will COVID-19 further entrench the rising inequality?
Well, we've seen examples of, you know, both New Zealand, Australia, but also the US that I know of government or wealthy individuals sending laptops, you know, to a lot of kids that wouldn't have a laptop otherwise. I think in New Zealand we hit like 90% of kids now have a laptop and can connect to school. I think again, because there was a problem and that needed to be solved, everyone kind of went there and solved that. So I think in some aspect, I think inequality will be solved and people will have access to technology. But it doesn't mean that for every country it's going to be the case, right? I don't know how they managed to do a full lockdown in India, for example. But the population is massive, and a lot of people, you know, are working on a hourly rate or a daily rate to be able to afford food. And if you can't go out and work, food is not going to come to you. So it would be interesting to see how a lot of countries are dealing with this. We're quite lucky here, you know, 5 million people, Australia 25. You know, it's manageable, but other countries have way bigger problems, and so COVID-19 will definitely have devastating effect that we're just starting to see. I mean, everyone is predicting that it will take us between 3 to 7 years to go back to the normal economy that we had before COVID, right? I mean, if you're in the airline industry, it's not tomorrow that all the flights will be back the way, no one's going to fly as much as we were flying before. So that's going to be interesting in terms of inequality as well, for all different countries.